I'm here at the Cosmetic Skin Clinic with celebrity doctor, Dr. Tracy Mountford, and we're going to be talking about a revolutionary new body sculpting treatment. Now, a lot of us do exercise, we have great diets, but sometimes it's really difficult to still get rid of those stubborn areas of fat. Now, Tracy, tell us a little bit about the typical patients that you see in your practice around body sculpting.
Well, more and more people want to recontour and redefine their bodies, but they don't want to lose ridiculous amounts of weight to do so. They often have very healthy lifestyles, they eat well, they exercise, but they've still got that little bit of extra fat that they want to address. And CoolSculpting, by fat freezing, is ideal to address those key issues.
So we're very used to knowing about the different types of treatments like radio frequency, which are heating the fat cells. Tell me a little bit more about the technology, because we're freezing fat, aren't we?
Well, CoolSculpting is basically what it suggests. It is freezing fat to sculpt the body. And there are two non-surgical ways to non-surgically address fat. One is by heating fat, the other is by freezing fat. And that's exactly what CoolSculpting does. It crystallises the fat cells by freezing them. Once we've assessed a patient and we know exactly how we're going to go about the procedure, they come in, normally in loose clothing, come in, we photograph them, set them up ready, mark out the area to be treated. We treat the area with the applicator, which is very, very straightforward. And then an hour later, we take the applicator off once the fat has been frozen, massage it, so we break down those fat cells, and then send the patient home and review them 8 weeks later.
So what areas can you treat with CoolSculpting?
The most popular areas for CoolSculpting are the midriff, so the abdomen, the lower abdomen beneath the navel or above the navel, often in middle-aged women. They tend to put fat down beneath the breast tissue and the navel, so here. The flanks, the inner and outer thighs, and bra fat. And in men, the most popular area, or one of the most popular areas, is the moobs. So the male breast tissue, we can actually reduce the size of the male breast.
So what results can you expect from this treatment?
Pretty impressive. I think people tend to think that this sounds a little bit too good to be true, but actually CoolSculpting is FDA cleared. It is proven to work and it is very safe indeed. So what happens is about 30% reduction is an average that we see on one treatment, and that's durable, meaning it lasts long term. That fat, once it's been crystallised, will not reappear, so you cannot put fat there on again. So ultimately, about 30% fat loss in one treatment, and then if patients want a bit more or they need a bit more, we can retreat and have more and more improvement. It's very impressive. For
celebrities, I mean, you must see a lot of celebrity clients. You've got these exclusive clinics in London and obviously out in Stoke Podgers.
Yeah.
Is it a celebrity treatment? You know, is it noticeable? Are they going to walk out of the clinic and go, you've had something done?
Yeah, no, that's a really good question. I mean, obviously it's a treatment that is very popular with celebrities, and we do a lot of celebrities with this because there is no downtime. So they can go back, they can work, and there are no telltale signs of anything being done. So it is very appealing. But it's popular with everybody. It's popular with men and women of all ages, and that's, I think, what makes it so exciting.
So what are the new innovations with this treatment?
One of the biggest issues for a lot of men and women is this fat pad underneath the jawline that's notoriously hard to get rid of. So we have a mini applicator that can be used to treat the jawline. And the lovely thing about that applicator is we can use it to treat knee fat and just the bra fat just here where you're wearing the cutaway dress. And that's a really, really popular treatment.
So what makes you the #1 clinic in Europe for CoolSculpting?
Well, we've been #1 for the past 3 years, and I think that's due to a few things. I think the main thing is that we have experts that just do this procedure on their own. They are just dedicated CoolSculpting practitioners. And it's the experience over time. It's learning what works the best, what looks the best in patients. And they're very artistic. They will look at a patient and know exactly what's needed to achieve the best clinical outcome. So I think all those things are very, very important. And monitoring the results. We monitor the results and make sure we get what patients expect and what we expect. It's all inherently very, very important to clinical outcome.
So what would be your top tips if someone's considering this treatment?
Do your research, make sure that who you go to is offering CoolSculpting. As I said, it is the only FDA-cleared fat freezing treatment, which therefore means it's safe and it works. So do your research. Make sure whoever does it is very experienced. I mean, all the team I have here have been doing CoolSculpting for 3 years, and we have been doing it day in, day out for those 3 years. So we're very used to treating patients. And make sure when you get your assessment, you know exactly what the procedure can deliver and what it can't deliver. Be very clear on that. And finally, when the treatment's done, make sure someone who does it is very artistic. They've got a very, very artistic eye. That's the thing we find makes the most difference. If you can visualise a patient in 3-dimensionally and really look at what you're likely to achieve at the end, you're going to get a very, very good outcome.
Fantastic. Well, if you're considering having any type of body sculpting treatment, CoolSculpting looks like a fantastic option. But I think the best thing is to come in for a consultation so Dr. Mountford can actually assess your cosmetic needs and go from there and get you the best possible results.